Hello and welcome to yet another episode of Health Business. My name is Oluwatoyin Kolawole, and on the program today we'll be looking at spinal injury, the causes, the treatment and management. Stay tuned.
A foremost IVF clinic in Nigeria, Nordica Fertility Center, and the Fertility Treatment Support Foundation has announced its 2018 edition for free fertility treatment program with a promise to put a smile on the faces of couples with infertility problem in Nigeria. Speaking at a media briefing with health journalists in Lagos, trustee of the foundation, Dr. Abayomi Ajayi, and Mr. Onora Moloku, an executive member of the foundation, stated that the foundation this year will be giving free treatments to 20 couples that are unable to pay for the treatment. They noted that the high cost of fertility treatment all over the world has remained a challenge for many fertility challenged couples, and this has denied them opportunity of accessing fertility treatment and the joy of completing their families.
The FTSF commenced operations as a non-profit organization with a mandate to provide free fertility screening and treatment to couples with compelling infertility stories, but are financially challenged. We assume. FTSF was established in 2008, and to date we have provided free screening and treatment to over 150 couples. Last year in particular, we embarked on the annual call for entries, and we got 5 couples to receive free fertility treatment. From this number, 2 of them have confirmed pregnancy. This year we are planning to do 80 free screenings, from which we will select 5 couples every quarter to qualify for free treatment, making a total of 20 for the year. We will want to also use this medium to solicit the support of charities, philanthropists, foundations, and corporate Nigeria to support this initiative. We want to help many more Nigerians access fertility treatment with a view to enabling them enjoy the joy of parenthood.
Moloku, however, noted that the Fertility Treatment Support Foundation was encouraged by the results from its previous interventions in this area of free fertility treatment since its inception in 2008, which has resulted in over 150 couples receiving free fertility screening and treatment. He enjoined interested couples to visit the foundation's website or its social media handles to receive information on how to qualify for the free treatment program.
On the program this morning, we'll be looking at spinal injury, what can cause spinal damage, and what are the process of treatment. To discuss this issue, I have a consultant spine surgeon, Pala Badia from India. You welcome on Health Business.
Thank you.
So let's start off this way. What is spinal injury?
Yeah, so a spine injury, it can be divided into 3-4 types. So it's like it starts from the early childhood and it can go to the middle age and to even the older age. So what is in the childhood is whenever you sustain any simple type of minor spinal trauma, then you can get the jerk into the disc. There are discs between the vertebral bodies. If you get injured into the disc, it can lead to back pain or neck pain. And when those discs, they touch your spine roots, the spinal nerve roots are compressed, it can give rise to pain into the whole arm or into the whole leg. So this is a type of disc injury. The spinal injury to the disc causes all these symptoms. Suppose it is a very major type of injury, so it can lead to spinal vertebral fractures in the spine, dislocation of the spine joints, and it can even lead to weakness in both the legs or weakness in both the arms. So this is the thing. Another type of fracture which you sustain in older age, we call it an osteoporotic spine fracture. So this is because of the weakness in the bones, the decreased calcium in the bones, which leads to these type of fractures. So this type of spine fracture you can get even without a fall, without any type of injury. Just at the home setting you can get this type of fractures. So these are basic 3 categories.
All right. What are the causes of spinal damage?
Yeah, so basically the damage to the spine can divide it into a lot of many joints. Sometimes it is an acute damage. Acute damage means this is the type of fracture. So you get some grievous injury, you sustain a fracture and you damage your spine. Sometimes it is a chronic injury. Chronic injury means your lifestyle, your habits, your posture. So if you have a lot of sitting work, lot of weight, heavy weight lifting type of work, lot of forward bending type of activities, what you get is you damage your disc chronically. So step by step, day by day, month by month, you damage your disc. Your disc get degenerated, and that degeneration leads to neck and back pain, what we see in our day-to-day life. And that is because of your lifestyle, which is sedentary, your habits, which are not your dietary habits, and obviously your posture, your sitting posture, your day-to-day posture in your lifestyle. So this is a type of chronic back pain, chronic spinal disorders, which are very rampant in our day-to-day life.
All right. Will you say rigorous exercise can affect one's spine? Or will you say a rigorous exercise can damage the spine?
So it is not the vigorous or the exercise which cause damage. It is the type of exercise which you do, when you do, that causes the damage. So if you are already having some type of disc problems, some type of acute disc problems, and then you do some type of wrong exercises like the forward flexion exercises, you get the damage. But if you learn to do what type of exercises to be done by a spinal surgeon or by a spine care physiotherapist, then you do it right, you are not going to damage your spine. So it depends on what type of exercises you do and when you do those exercises. It's very important.
Okay, let's now move to the management of a spinal cord injury. What are the process like?
Yeah, so initially it was like 5-10 years old management. It was an open type of surgery in the spine, which was very rampant. But nowadays these open surgeries has been abundant. We do 80 to 90% of the spinal management by endoscopic or a keyhole surgery. Okay. So what is exactly keyhole surgery? It is a very short incision through an endoscope. We can do the spinal surgeries. So just with a 2 centimeter incision just off your nail tip, you can do all type of decompressions, all type of spine management. And the advantage of this is the patient can go home very next day. He can walk. There is no bed rest which is required after spinal surgeries, and the post-operative complication rate, which used to be very high initially, has been reduced to almost nil. So these are all the advantages of that.
Now, you just talk about the treatments. How expensive are these treatments? Are they affordable?
Sorry, how expensive?
Yes, how expensive?
Yeah. So it actually the spinal cord treatment is divided into various types. It can be as simple as a pure discectomy, where you have to just remove the disc, or when you have to put some type of metal implant inside, like the screws. So if you have to put screws inside, then it is a bit costlier. But if it is just a plain decompression in which you have to remove the disc, you have to free the nerve roots, then I don't think it's that much costly.
Lastly, I want you to advise people on how to keep safe, on how to make sure that they don't have any kind of spinal injury that can lead to a damage.
Yeah, so the care depends, I will divide it into 4 to 5 categories. First of all, the care of the spine as well as the whole body. For that you should have your daily walking. So at least you should, in the morning as you get up, you should daily walk for 3 to 4 kilometers or 45 minutes daily. That stretches all your body joints as well as keep your spine healthy. Second are the back and the neck strengthening exercises. So these exercises, it is like a food to our muscles. So as the muscles, with the exercises, your muscles strengthen up, and these protect your spine, because the spine is covered by muscles. If the muscle is strengthened, your spine will get degenerated far lesser. So exercises are very important. 15 minutes of exercises prescribed by a spinal surgeon or a physiotherapist are very important. Third very important thing is diet. So we should have a calcium and vitamin D rich diet, and that is by eating we have to include something in the diet which increases our calcium in the bones, so that the bones don't get degenerated, don't get damaged faster. And fourthly, we should have good posture. So when we are sitting, when we are doing our daily activities, when we are sitting on like the company jobs, then we should have a proper posture. That is also very important.
Well, it has been so nice having you on the program this morning. Thank you very much.
Thank you. Thank you.
Hello viewers, I'm Dr. David Ikudaisi, a board-certified internal medicine specialist in US, and I'm also a regenerative medicine specialist. I'm here to educate you on regenerative medicine. For those who are not familiar with the term regenerative medicine, it's a new branch of medicine that aims to restore normal functioning of the tissues and cells and tissues in the body, of the area of that body that has been damaged either by disease, age, or due to congenital conditions. Now, regenerative medicine comprises platelet-rich plasma therapy and stem cell therapy. The stem cell therapy can also be divided into three areas, which is embryonic stem cell therapy, induced pluripotent stem cell therapy, and adult stem cell therapy. The first two that I mentioned, they are still in research stages because of the possible side effects that they may pose to human beings. But the third one, adult stem cell therapy, is gaining popularity due to the fact that it has been proven to be safe, although there's still a lot of studies and research going on. But today, it's still possible to use adult stem cell therapy to address some conditions or issues that the orthodox medicine have already said there is no further cure or treatment available. Now, I would like to also explain what platelet-rich plasma is, because some people may not be familiar with what this is. Platelet-rich plasma is when you use a patient's blood to treat the patient by first of all concentrating the blood and separating into plasma and red blood cells. There's a section after centrifuging the blood that is very rich in platelets. That is where the name platelet-rich plasma comes from, and can also be referred to as PRP, therapy. And what you get is that in that sample of blood, the platelets are being concentrated about 5 to 10 times more than the baseline, and that allows the area where you need it, to get the benefit of high concentration of platelets. As far as stem cell therapy is concerned, a stem cell is any cell that can self-replicate itself or differentiate into any matured cell. Now, there's been a lot of controversy about stem cell therapy. Keep in mind, this is just when people are talking about embryonic stem cells. And the reason of the religious or ethical controversy is because embryonic stem cell therapy involves using, let me say, embryons, which sometimes they are being donated by the IVF clinics, because these are all potential human beings. Therefore, there's a lot of religious reasons, controversy about that. The second type that I mentioned earlier, the iPSC, which is induced pluripotent stem cell therapy, is like when you take someone's skin to the lab, reprogram it, and make it maybe grow the nose, hair, or some tissue organ from it. That has similar characteristics like the embryonic stem cells, but they do not have any religious controversy, because you are not dealing with potential human being here, you know. And then the third type of stem cell therapy that I mentioned earlier is called adult stem cell therapy. The word adult is not about age, but it is just referring to the fact that the source of that stem cell is from fully formed human. So that because adult stem therapy covers umbilical cord blood, bone marrow transplant sometimes is considered under regenerative medicine, and also fat from the abdomen can be a source of the stem cells. So to make it a little bit clearer, there are three sources of adult stem cell therapy, which is the only type of the three stem cell therapy that today currently have clinical applications. And those three sources are umbilical cord blood, bone marrow, and fat. So those are the three sources. I hope I've been able to break down or explain what regenerative medicine is all about. Next week we will continue by discussing what are the ailments, conditions that regenerative medicine can address. I'm Dr. David Ikudayisi, regenerative medicine specialist. Thank you.
Now that you know what can cause injury to your spine, I'm sure you'll be able to take good care of them so you not come down with a spinal injury. Next on the program is this pharmacy segment. Stay tuned.
The supply chain for pharmaceutical products is a very critical part of the health systems of any country. Hence, there should be strong policies in place for distribution of medical consumables so as to put in check fake or substandard drugs. Such policies will also reduce the operations of open drug markets to the barest minimum. Pharmacies are unanimous that effective supply chain management remains an important key to improved health system. They further pointed out that such systems require specialized talents, expertise, and innovations to improve availability of medical commodities as an enabler for optimal healthcare service delivery. While a well-functioning health system ensures equitable access to essential medical products, vaccines, and technologies of assured quality, safety, efficacy, and cost effectiveness, Nigeria's healthcare system is laden with several underlying challenges ranging from limited adoption of private sector capabilities and expertise to advanced supply chain system performance.
The supply chain for the pharmaceuticals and related healthcare products is a very critical part of the health systems. So a good thing to always bear in mind is that the best way to achieve results in any endeavor that we have is to take a systems approach. So when we understand that, we will see the value that the supply chain plays in the spectrum of the healthcare system. So before I delve into this supply chain itself, we need to see it in the context of what are the other building blocks of health systems in general. The WHO has about 6 to 8 of them, and I think Nigeria added some. So everything starts from stewardship, role of government. Government is the decider of what systems will be in play. So that stewardship role of government includes the policies it makes that affects or dictates the environment for the supply chain and other parts.
Professional pharmacists in Nigeria revealed that there is a need to unlock private-public sector partnerships of local content for supply chain management of medicines. This in turn will improve Nigerians' access to medicines for conditions prevalent in the West African region.
For the drug supply chain, you start from the sourcing. So that sourcing will be considered as upstream. If we were in the petroleum industry, you would say that's the upstream exploration, right? So the sourcing in Nigeria, globally, sourcing is from raw materials, active pharmaceutical ingredients, formulation, production. So what goes into the medicine first has to be produced before it becomes compounded into medicine. So the first thing to note is that, are we in Nigeria participating in that part of the supply chain? The answer is no. We don't. So from the beginning, so we're used to looking at things in isolation. That's why I emphasize the systems thing. So the first thing is we have to look at the entire value chain of that supply chain, starting from the sourcing and procuring the active pharmaceutical ingredients is the first step, going on into the manufacturing.
Pharmacists conclude that since the federal government decides on all policies, it's important it implements a strong drug distribution chain that will enhance the healthcare delivery system in the country.
Manufacturing is something that government, through its stewardship role, is actively encouraging, making policies to support local pharmaceutical manufacture, and that's a role that it has to balance with its duty to the public to ensure that drugs are available when needed. So that means if your country's manufacturing capabilities is not yet at the point where it can meet 100% of your population's needs, then you have to import. So sourcing does not say manufacturing, it says sourcing. So if you have capacity to manufacture, all well and good, that should be encouraged.
It's now time to join Dr. Abayomi Ajayi on understanding infertility.
Yeah, based on research and from doctors too, they say that lifestyle, healthy lifestyle is actually very essential to fertility. It's very key when it comes to fertility. And I asked myself this question, like, what actually is a healthy lifestyle? Well, what do you think about that?
I think exercise is key. You just need to be fit, and exercise is what's going to give you a healthy lifestyle.
Hello.
Hi.
How are you all today?
Thank you.
Yeah, I hear you're talking about lifestyle. Yes. Oh, wonderful. I think that's what we'll just make the topic for today's episode. Welcome to Understanding Infertility. My name is Dr. Abayomi Ajayi. And we just like we started, we're going to be talking about lifestyle and fertility today. And when we talk about lifestyle, I heard what you were saying. These are choices that we make.
Okay.
And fortunately, they are modifiable habits and ways of life. And they can greatly influence our general fertility, our well-being and fertility as well. Well, we'll look at some of the factors. Well, I heard you talking about exercise. Well, I won't start from there. I'd rather start from age. Because this is something that it's what is happening now. People are getting married at later age for different reasons. Either education, either they want to pursue a career, and this affects both men and women. People think it's only women that age affects, but you know what? Men are also affected, because we know that testosterone, the hormone that produces the semen in men, decreases with age. It's a natural thing that just happens. So we know also that parameters in the semen also decline from about age 35. And after 40, actually, the DNA, that's the man, all the man contributes in reproduction is his DNA. And this also, we have seen that there is a lot of fragmentation in the packaging of the DNA after age 40. So there's so many things that actually, so that's why you see, even for men who are older than 40 years, their partners take longer, even if they marry young wives, take longer for them to conceive. But for the women, it's actually, seriously, women are actually responsible for fertility. And therefore, when the older they get, the more difficult it is for reproduction to happen. The other thing that we can look at is what you mentioned about diet, which is also an exercise. Yes, exercise is good, but excessive exercise is also not very good, both for men and for women. One thing we know that weight is also very, very important. Obesity does not augur well for both the man and the woman. But we know that men who are overweight the sperm concentration is lower in them, motility is lower, DNA damage is higher, and there is erectile dysfunction also is commoner in people who are overweight. For women, it's very grave that an ovulation, they don't ovulate regularly because the body has a way of interpreting there is enough estrogen in the system because of the ones that come from the fat. And then so they forget to ovulate sometimes, and miscarriages are commoner in them. And the other thing that people talk about is stress. Now this is the story of the chicken and the egg. We don't know which one came first, Whether it's stress that causes infertility or is infertility that causes stress, it's difficult to tell, but you know that stress can be psychological, can be physical, and can be social, but they are associated with infertility.
We've come to the end of today's package. You can be part of this program by calling the numbers showing on your screen. Remember, living healthy is a serious business. My name is Oluwatoyin Kolawole, and the program is Health Business. Bye for now. Thank you.